How does an endoscopy show a hiatal hernia in GERD? Imagine looking inside your own body without making a single cut. That's what an endoscopy does. When doctors suspect a hiatal hernia is causing acid reflux or gastroesophageal reflux disease, they often turn to this procedure. During an endoscopy, a thin, flexible tube with a tiny camera at the tip is gently inserted through your mouth and down your throat. It travels into your esophagus and stomach, giving the doctor a clear view of the lining and structures inside. The main thing they look for is the position of the gastroesophageal junction, the spot where your esophagus meets your stomach. Normally, this junction sits just below the diaphragm, which is a muscle that helps you breathe. But if a hiatal hernia is present, part of your stomach pushes up through an opening in the diaphragm called the hiatus. This causes the junction to move upward into your chest cavity. The doctor checks for the squamocolumnar junction, which is where the esophageal lining changes from flat, squamous cells to thicker, glandular cells of the stomach. They also look for the gastroesophageal junction itself, where the tube of your esophagus meets the stomach's rugal folds. Those are the ridges inside your stomach. To confirm the hernia, the doctor might ask you to take a deep breath or sniff, which causes the diaphragm to contract and makes the diaphragm's muscle fibers, called crura, easier to identify. A key sign of a hiatal hernia is when the gastroesophageal junction and the top of the stomach are seen to have moved above the diaphragm by at least 2 centimeters. This displacement is visible on the camera feed and confirms the diagnosis. Seeing this abnormal position helps explain why acid reflux happens more often, because the hernia weakens the lower esophageal sphincter, the valve that normally keeps acid in your stomach. During the endoscopy, the doctor can also spot other issues caused by acid reflux, like inflammation of the esophagus, ulcers, or changes in the lining called Barrett's esophagus. This detailed view helps guide treatment, whether it's medication or surgery to repair the hernia. Endoscopy is a quick, safe way to get a clear picture of what's happening inside your upper digestive system, making it a vital tool for diagnosing hiatal hernias in people with acid reflux symptoms.